Hello, I'm Conor Meade, and we're here today at the 2015 Canadian Science Policy Conference. And joining me today is Dr. Cedric Bisson, a partner at Teralys Capital. So thank you so much for joining us, Cedric. We really appreciate you being here.
Thank you so much.
Thank you. So why don't you start off by telling us a little bit about Teralys Capital and your role there?
Thank you very much. So thank you for the invitation. Teralys Capital is Canada's largest technology fund of funds manager. So we have $1.6 billion Canadian under management, and we are a large investor in the venture capital asset class, who invest in venture capital funds. We invest in information technology, life sciences, as well as clean and industrial innovations. The bulk of what we do is IT and life sciences, however. We have had the benefit to have support from a number of programs, and our latest fund was raised under the federal government Venture Capital Action Plan program, or VCAP. Teralys Capital ultimately believes in supporting entrepreneurs, so our funds ultimately are channeled through direct investment funds and then channeled through actual entrepreneurs and companies, startup companies as well as growth stage companies. Teralys Capital was founded in 2009, and I focus on life sciences at Teralys Capital. I'm in charge. I'm the partner in charge of all of the life sciences investments for the firm.
Excellent. So I wonder if you can tell us a bit about some of what you feel are the upcoming life sciences innovations that have the greatest possibility to prolong and improve human life, and perhaps specifically life sciences innovations that you're particularly interested in.
Sure. So I'm trained as a medical doctor, as you know, and I've been involved in drug development for quite some time. So obviously these things are of keen importance to us, because what we do is translated into treatments that will improve and hopefully solve some of the biggest human ailments that are still not solved. And so generally speaking, and so that's number one. Number two, obviously, Canada has been quite competitive in figuring out new inventions, new discoveries. It has to remain competitive. In terms of the innovations coming forward, I mean, obviously everybody has seen the latest development in oncology. So in oncology, there has been tremendous new improvements in the ways that one can treat cancer using the body's own immune system. So the whole field of immuno-oncology has been booming. And for us, that's a sector where we or our funds have invested, and where we think there's tremendous potential. So the engineering of T cells, the engineering of cell-based therapy, immunomodulators, all of these things are for us an area of great importance. The sector is also helped by the fact that the regulators, especially in the US, the FDA, has been creating the right kind of framework for those innovations to be tested in humans under ethical guidelines, of course, but tested more rapidly and approved conditionally over time, which allows for faster translation from university invention to actual clinical practice. So our funds as a whole generally tend to be big in oncology, which mirrors what we see in the US and in Europe, where the sector has been doing relatively well, because ultimately it's driven by a desire to find treatments for cancers. So oncology is a big sector. The other, and oncology, drug development, cell therapy, all of these things. The other sector where we have seen quite a bit of investments is in the field of orphan diseases, or diseases which are rare, where a treatment, either an enzyme replacement treatment or a treatment which is very specific to a rare disease, can be proven on a small number of patients and can be obviously then used relatively rapidly. The challenge for that sector, obviously, as you have seen in the news, is related to the pricing of those treatments. The pricing tends to be high, and so therefore the value proposition for those treatments need to be nailed down in a way that makes sense for the payers, for the insurers, and for the healthcare system. The third sector would probably be monoclonal antibodies of various kinds that could be used either in oncology, inflammatory diseases, inflammatory bowel diseases, certain respiratory diseases, and that sector is a sector which has been tremendous progress for us. So the creation of antibodies which can act on two targets, bispecific antibodies, or the creation of antibody fragments, all of these things for various domains of activity is of great interest to us. Last but not least is the CNS and neurological sector, so central nervous system. All of the diseases of the central nervous system are have significant unmet medical need. If you look at historical numbers in that sector, the investments had been reducing for reasons related to perception that there was less innovation and reasons related to the complexity of diagnosing the patients and doing clinical trials that would have a chance of success as opposed to only a very high risk of failure. There's developments, we're not as advanced as we are in the field of oncology, for instance, but there has been some good progress made, still early though, in the fields of certain of the neurodegenerative diseases, still early stage, but you see some financing in Alzheimer's, Parkinson's disease. I think mental health is also very important. This sector is unfortunately still lagging in innovation, and we hope that there is improvements in mental health soon.
Excellent. Thank you very much for that answer. So in keeping with the theme of our breakfast panel this morning on innovative financing models, and also given your position at Teralys Capital, I wonder if you could tell us a little bit about some of the barriers to access to capital in Canada, and perhaps offer some advice to policymakers for how we can improve innovation in the life sciences and other sectors by improving access to capital.
Okay, well, indeed, access to capital is of critical importance because without capital it is not possible to translate or to advance an innovation from the university setting into tech transfer, into companies, and into larger companies over time. So I would say, obviously, the innovation needs to be the right innovation that should be translated. So the appetite for capital is almost an insatiable appetite because there are always more innovations out there than there is money to be there. So it's I would probably say as a first comment that one of the things that needs to be done is to focus on the right disruptive innovations that really change things as opposed to incremental things. And so there are certain innovations that may or may not warrant venture financing or access to capital, and it's okay, they should be developed otherwise. Now, for the innovations that do warrant financing, indeed, access to capital is something which is definitely always a challenge. And I would say that there have been some good efforts by the federal government in the past to properly capitalize funds of funds. Of course, Teralys is a beneficiary, and we're very happy to be a beneficiary, but ultimately we are a way to transmit funds into venture funds and from venture funds into companies. And we need to have enough capital, and our colleagues need to have enough capital so that we can adequately capitalize the funds so for the venture funds to exist. And so while to the entrepreneurs and to the scientists we may not be visible, our role is very important because without adequate pools of capital, that's at a higher level, the venture funds can close, and if the venture funds can close, then the companies don't have money. So that's obviously an issue. The related to that, I think an increased participation from pension funds, corporate pension funds, industry players, and a bunch of people that have historically left the venture capital space would be desirable. The Venture Capital Action Plan allows for that to happen, and we would hope that whatever is done going forward replicates that model or continues that model so that we can excite and make possible for those investors that have large pools of capital to come into the asset class. That would be very important, either through fund of funds or through funds or into companies. Last but not least is making sure that we have stability in terms of the public policies that we have at the federal level. So things such as SR and ED tax credits, for instance, which are important when used properly, or various programs that exist either at the federal level or the provincial level. So the are important. Some of the NCEs that do exist allow for capital on more favorable terms to be provided to companies. So that's obviously something. All of these things are quite important.
Excellent. So as a final question before we wrap up, for the benefit of everyone viewing, I wonder where can we go to find more information about Teralys Capital and dig a little bit deeper into some of the topics that we discussed today?
Sure. So obviously we have a website, so teralyscapital.com. It contains information about the funds that we have done, as well as some press releases. I would say probably the easiest thing if you have a question to Teralys is just to reach out to us. We're open to business. We're always excited to meet new entrepreneurs, scientists, people in the field, we're always very happy and consider it our duty to participate in public policy discussions, because ultimately this is all about public policy. And so we participate in various government fora, government-related fora, and so I would say reach out to us, send us an email, contact us by phone, and we'll be very happy to discuss things and either interact or do something directly, or direct you or direct whoever calls us in the right direction.
Excellent. All right, well, we'll be sure to include a link to Teralys Capital in the description of this video. And once again, Cedric, thank you so much for joining us. It's been an absolute pleasure to chat with you.
Thank you very much.
Thank you.